Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Joe Braid, a certified professional coach and rehabilitation physician.
Welcome back to the Burnout Recovery Podcast. My name is Dr. Joe Braid, and I'm delighted to have you here this week. So this week, I'm keeping it fresh and recent rather than batching up my podcast episodes, and I'm actually going to be reflecting on uncertain times that we had here in New South Wales hospitals in the past week. So this past week, we witnessed something significant. Junior doctors took strike action in response to overwork, staff shortages, and inadequate compensation. And you might be aware through my chats along the weeks of podcasting that I have been covering the rehabilitation ward at Bathurst Health Service for a 6-week locum period. And I really found myself in an interesting position where I wanted to support the legitimate concerns of junior doctors while also needing to ensure patient care continued on my rehab ward. The absolute blessing that I feel we have in a rehabilitation model of care is that therapy, patient outcomes are not fully doctor dependent. And much as people said we were having a public holiday staffing equivalent, we still had a full load of therapists, including a lot of senior students who were wonderful help for all of our varied patients and their therapy needs. So in terms of care, we still had a lot of care going on in the rehabilitation ward. However, the reflections I want to talk around are navigating the uncertainty, not just as a physician, but as someone deeply committed to healthcare professional well-being. Because the truth is, these strikes highlight something we've been discussing on this podcast for years, the unsustainable demands placed on healthcare workers and the critical importance of systemic change. So I was very mindful about this and really started addressing it on Monday, although the strikes weren't happening until Tuesday, Wednesday, Thursday. And I made a deliberate choice about how I would show up. At our morning meeting, I began with a simple message: we can manage this together. And this wasn't about toxic positivity or dismissing the challenges ahead. Rather, it was creating an intentional starting point, one of collaborative problem solving rather than panic or frustration. And by staying calm and confident, I created psychological safety that allowed team members to voice concerns and contribute solutions. So together we looked at our capabilities, our constraints, and then we really prioritized what needed to happen. Essential care. We enhanced communication with patients and their families, providing transparent updates about potential impacts while reassuring them of our commitment. And this approach really transformed potential frustration into understanding and cooperation. And so what I witnessed was remarkable. We never actually had low staffing levels on the 3 days I was working last week. However, we had that sense of innovation. So with that space of something's going to be different, what can we create around here? And I would say that there was a real sense of support and camaraderie, and everyone is valued as they are every single day. And your choices are your choices, whether you choose to strike or not. Communication really sets us all up so well for success through the week. Then over the this weekend, I participated in a beautiful meditation called Becoming the Mountain. And this is adapted from Jon Kabat-Zinn's work. So the parallels between this meditation and what we experienced during the strike were really similar. So in this meditation, you visualize a magnificent mountain. For me, it was really easy to go to Mount Canobolas, our really nearby large mountain we have here in the central west of New South Wales. Solid, unmoving, and beautiful. As the meditation progresses, you embody the mountain's qualities. And here's a quote: "Grounded in the sitting posture, your head becomes the lofty peak, supported by the rest of the body. With each breath, become a little more a breathing mountain, alive and vital, yet unwavering in your inner stillness. And this meditation reminds us that while the mountain experiences constant change on its surface, seasons shifting, weather patterns coming and going, visitors arriving and departing, people giving their opinions on whether they think it's a good mountain or not, or they came on the right day or the wrong day, the mountain itself remains stable, rooted, and unchanging in its essential nature. Here's another quote. In the same way as we sit in meditation, we can learn to experience the mountain. We can embody the same unwavering stillness and groundedness in the face of everything that changes in our lives. And I would say this is precisely what healthcare requires of us during times of uncertainty, to be like the mountain, to acknowledge the changing conditions around us while maintaining our core stability and purpose. My word of the year is simplicity, and I've referenced that already during the podcast in 2025. And this past week demonstrated why simplicity matters so profoundly during challenging times. When we're faced with complexity and potential chaos, our response wasn't to add more complexity with elaborate contingency plans. Instead, we simplified our focus to what truly mattered: essential patient care and team well-being. And you could have put those in the reverse order as well. This simplicity principle applies equally to how we maintain our own well-being during uncertainty. And for myself, through every day last week, not only the days that doctors were striking, I maintained my well-being through consistent self-care practices. And here's just a few. So micro moments of mindfulness. I love doing some breath work, maintaining boundaries, and ensuring proper rest. And these weren't indulgences. These were necessities that allowed me to show up as my best self for my team and patients. So why healthcare professional well-being really matters. And I guess the junior doctors' strike brings into sharp focus something I've been advocating for years. Healthcare professional well-being isn't a luxury, it's essential to the future of healthcare itself. And here are a few reminders of what happens when healthcare professionals are chronically overworked, underpaid, and undervalued. Firstly, quality of care suffers. Exhausted clinicians make more errors, have less emotional bandwidth for compassionate care, and struggle to make optimal decisions. Secondly, workforce sustainability collapses, and we're seeing unprecedented numbers of healthcare professionals leaving the profession entirely, creating a vicious cycle of increased workload on those who remain. Innovation stagnates. When we're in survival mode, we lack the mental space for creative problem solving and system improvement. And finally, the human cost is immense. And behind every burnout statistic, at least 63% of medics or doctors in healthcare in a 2021 survey said they had experienced burnout within the last 6 to 12 months. So behind every statistic is a real person, someone who entered healthcare with passion and purpose, now questioning their career choice and often struggling with mental health and loss of meaning. So this strike action isn't just about pay or hours. It's about creating a healthcare system that values and sustains its most precious resource, the humans providing care. So I'd like to leave you with some practical strategies for uncertain times. Whether you're navigating strike action, organizational change, or personal uncertainty, here are some mountain-inspired strategies to help you maintain stability. Firstly, start with intentional calm. Before reacting to challenges, take a breath and choose your starting point. Remember, your energy affects everyone around you. 2, create psychological safety. You have the ability to foster an environment where concerns can be voiced without judgment and where collective problem solving is encouraged. 3, simplify your focus. When everything feels chaotic, return to what matters most. What is the essential work that must happen and what can wait? 4. Practice those micro moments of mindfulness. I am going to eke out that podcast episode, which seemed to be so helpful and resonated with so many people. Even 30 seconds of conscious breathing can reset your nervous system during stressful moments. 5. Maintain boundaries, especially during crisis. Be clear about what you can and cannot do. And sustainable contribution requires sustainable practices. And finally, connect with your mountain nature. Remember that beneath the changing weather of your circumstances, there's a stable core of who you are and why you do this work. So as we navigate these uncertain times in healthcare, I recently did a Women in Leadership award application, and this is part of what I said in there. This experience reinforced that unexpected challenges often reveal hidden strengths within teams. I learned that calm, confident leadership creates the conditions where innovation can emerge even during disruption. So to you, my fellow healthcare professionals, whether you were striking, covering additional shifts, or navigating the complex emotions of the past week, I want you to know that your well-being matters, not just to you personally, but to the very future of healthcare. So here's another quote I used on Instagram recently. Take those micro moments I talked about. Breathe, connect, go outside, and be compassionate with your decision. You're standing up for a system that needs to work for everyone. Remember, like the mountain, you can acknowledge the changing weather around you while remaining grounded in your essential nature, your compassion, your expertise, and your commitment to care. So that's it for this week's podcast episode. This is Dr. Jo Braid reminding you that sometimes our greatest strength comes not from doing more, but from being more intentionally present, like the mountain, unwavering in our core purpose while adapting to the changing world around us. Thank you for listening to the Burnout Recovery Podcast. If you found this episode helpful, please share it with a colleague who might benefit. I'd be so grateful. Thanks so much. I'll see you again next week. Thanks for listening to this episode. Schedule a 60-minute power hour with me and leave with relief, decisions made, and clear next steps. Or send me an email for a speaking inquiry. All information is available at drjobraid.com with links in the show notes.